For me, you know, I really want to do research, I really enjoy it, and I want what I do 9 to 5, if you like, to have an impact, you know, to maybe just change a little bit of something that improves people's health. So I have an interest in healthcare improvement, health inequalities. So basically looking at you know, what inequalities there are and how we might work towards overcoming them. So particularly working with kind of hard to reach groups and looking at their healthcare needs and how we might improve service provision for particular sections of society. I've been at the university about 7 years now, 7 or 8 years, and we've received funding from various different sources. So since I've joined Nero's team, we've had funding from a European Commission Framework 7, which funded a study called Corley-Cops that I'm working on. We've also had a couple of successful College Research Fund grants, and my PhD work was funded by an NIHR Research for Patient Benefit.
Well, the study that I'm taking part in at the moment is a European funded study, and it's called CaHRU, which basically is about having equipment in patients' home in order so they can monitor themselves, the clinical data on a daily basis, and that it will set off clinical alerts if needs be, which will be dealt with by the practice. It'll show whether monitoring at home monitoring, actually makes a difference to patients in terms of reducing hospital admissions and improving their quality of life. It's really good. We're all working towards health, you know, health promotion and health of the public and patients in particular.
We are trying to develop an application for all the people with multiple morbidities to help them navigate our care system at the moment, because it's rather fragmented and not very well integrated, and we want to help them find their way through the care system as one would do with a GPS to find his or her way to another location. Especially people with multi-morbidity, they already have the burden of having more than one disease, which can be something that almost controls your life. And then on top of that, having to figure out where to go, when to go to, and who to go to, it can be quite daunting for them. I think the overarching thing is quality of care, whether that is emergency medicine, primary care, or even mental health. It's quite a diverse range.
So my role within CaHRU at the moment focuses on my PhD doctoral research, which the overall title is the development of a patient-reported experience measure for use in the UK ambulance services. Well, the goal and what we hope to find and what we hope to happen is that we'll have a measure that can be used to benchmark patient experience levels within the different ambulance services, so that we can perhaps start to look at differences between organisations, but also within organisations. So for example, within East Midlands Ambulance Service serves different regions. You've got Lincolnshire, Nottinghamshire, Leicestershire, etc. And to look at the differences, if there are any differences between patient experience reported levels in the different areas. Once we have those results and once that's routinely collected, you can start to look at ways that we can improve patient experience, which is ultimately what the goal is. I am the recipient of one of the first round of College of Social Science PhD funding studentships. So within that, they funded my time to do the research for 3 years, and also enabled me to be a member of CaHRU and to work on any additional projects within that. Well, I think I'm really fortunate because I was a member of CaHRU before I started my PhD, and the team has just grown sort of exponentially since I started in 2010, and it's a really friendly, really good environment to work in, where there's always somebody to ask if you're not sure about something, and it makes the experience of doing a PhD, I think, less isolating and less kind of maybe scary.